Finding problems? That's easy. They exist in every community. I'm Terry Springs, your host. We're looking deeper, and we are talking solutions, finding out how we all can make a difference. Facts are heart disease is the #1 killer in the U.S. of both men and women. So we got a heart specialist to come in and give us some advice. It's all about your heart this morning with Dr. Jonathan Lee from Southwest Medical Associates.
I specialize in cardiovascular disease. I treat patients that usually have known what we call coronary artery disease, or CAD for short. And those patients usually have suffered a MI, a heart attack, myocardial infarction, or have had some sort of intervention such as balloon angioplasty, percutaneous coronary intervention, or what we affectionately call CABG, which is coronary artery bypass graft surgery.
I haven't heard the word cabbage before.
Okay, yeah, well, it's not like here in Las Vegas, cabbage meaning something else. But usually when you have a cabbage, that does mean that you've had some serious heart disease and you require some bypassing in order to correct those abnormalities. And so as a cardiologist, when I see these types of patients, we focus a lot on secondary prevention, aspirin therapy, statins to keep their cholesterol, as well as reduce coronary events in the future.
When you talk about things like statins, there are so many people in this country, certainly in the U.S., who take statins.
Yes.
Isn't it one of the most widely prescribed drugs of all?
It probably is. I believe Lipitor is probably the most prescribed drug of all time, partly because, as you may or may not know, unfortunately, cardiovascular disease is the #1 killer in the United States. And so we have a lot of people that suffer from cardiovascular disease and would have strong indications for statin therapy.
Lipitor is taken by someone in my household, not me, but my other half. I know his whole family has a history of heart conditions. Are a lot of people through their genetics predisposed to having to deal with this?
There's a lot of risk factors that play into cardiovascular disease. Family history is very strong, but also some lifestyle things that we don't necessarily want to think about. Smoking is probably the greatest risk factor for having cardiovascular disease, as well as increasing the risk of stroke, diabetes, being overweight, high blood pressure, and again, high cholesterol.
All things that are pretty darn common here in the U.S.
Correct.
Unfortunately, but there are things also, maybe we'll discuss this in a moment, some things we could do as far as altering or modifying our lifestyles to make it less likely that we have to deal with these more severe situations.
Definitely. One of the best things you can do for yourself is to do some form of daily exercise. The American Heart Association does recommend moderate exercise, 30 minutes a day for 5 days a week. They say 150 total minutes, and you don't have to do continuous 30 minutes. You could break it up, maybe 15 minutes in the morning, 15 minutes in the evening.
Go out on your lunch break. Right. Walk around in the beautiful weather that we have so often here in Las Vegas.
Definitely, yeah. No excuses here. We're not snowing, so it's easy to go outside and enjoy the sunshine.
Been there, done that. Like it here a whole bunch more. Being that February is National Heart Month, we want to shine a light and try to share some information. I would imagine a lot of the people who hear us today on Talking Solutions, and we are talking this morning, by the way, from Southwest Medical Associates with Dr. Jonathan Lee. He knows about this heart stuff, and chances are you may deal with it, if not yourself, someone within your family or household, coworkers, your social circle. People deal with heart issues. So we'll see what we can do to give you some good knowledge so maybe you can lessen the impact in your life. There's a lot going on, though. I tell you, with the lifestyle, type 2 diabetes is my soapbox issue because I so believe that conditions like that are truly, in most cases, preventable if we would just make some small changes in our lifestyle.
Right. I see a lot of patients that, in a sense, you feel a little powerless because, you're overweight and you've been like that for a long time. But there is things that you could do, and they're not very hard. Again, walking. Take a stroll, 15 minutes, and I usually tell most of my patients, you have to make it a habit, a good habit. Even getting a treadmill, which I said, get a treadmill, put it in front of the TV. And so when you watch that 30-minute episode of, whatever, reruns of Friends.
Okay, you know my lifestyle, I got it.
Then that 30 minutes of walking, you don't even notice it. And then the days go on, you should increase that level as well as increase the frequency. And then before you know it, it'll become a very good habit and you take control of your life.
I would imagine also, Dr. Lee, that there are some other things as far as our nutrition that we can do, little slight changes that can also help us in the area of heart health and overall general health. Things like reducing our sodium intake.
Sure. Sodium is a little tricky because most of the foods that we eat, if we don't prepare it ourselves, meaning if we have the luxury of going out to eat, and here, with all the buffets in Las Vegas, there's a lot of prepared foods. But even stuff that are frozen and canned, Salt is a preservative, so salt is hidden everywhere. I had a patient the other day who had some bottled water and he was drinking Propel water.
Right.
If you read it, you would think water just has water, maybe some flavoring, but there was sodium in there.
They add sodium to the water?
I guess it makes it taste better, or maybe people like it. But yeah, even in the water, there's sodium. A lot of those flavors nowadays that people really like because it, adds a little bit of difference to the water.
Sodium in water? Are you kidding me? The water I brought for you, no sodium. I have it right here.
All right, it's heart healthy.
When you're dry, I got it right here.
Perfect.
But even water, nutrition is a huge thing to me. It's something that I'm incredibly interested in. I think it makes a huge difference in your life. In the hallways, they always know when the snacks come around that I'm really not interested because I've got the raw almonds to snack on.
Correct.
I've got maybe some plain Greek yogurt to snack on or something like that. I've got the really healthy snacks. But when you get me into the grocery store, I'm looking at every nutritional information panel on everything because I want to see what the sodium level is. Soups are terrible.
Yes, they're terrible.
For sodium.
And even as you're probably aware, the labels are going to be changed pretty soon because I want to say they kind of mislabel things. Because even when you look at a serving,
yes,
especially soup, for instance, you say, oh, there's only 860 milligrams of sodium in this soup. If you read it very closely, that's usually for half the can.
Right.
And as we all know, we eat more than half the can.
Yeah, I'm willing to share, but there's a limit. But you're exactly right because they're basing the nutritional information on the panel on serving size. You need to check real close and see what the serving size is.
Yes.
Because it makes a huge difference. But there are certain foods that are very high. Also, there's a lot of sugar hidden in certain foods. I like to use as an example, when you buy a jar of spaghetti sauce, take a look. There's sugar hidden in there. They do that for a lot of reasons. It's cheap for the food producers. It also adds a taste element in there that makes it a little easier to get you hooked on the flavor of that. Yeah, I'm up on my little soapbox all the time, railing about salt and sodium and things. To me, the closer to natural that we can eat, the better.
Correct. Less processed foods. But here it is also very difficult because what's more accessible and less expensive are the ones that are already processed, frozen, preserved. And so trying to make that healthy lifestyle, that healthy choice is, in a sense, not as cost effective for most people because it takes that extra step to get the fresh vegetables versus the stuff that's been canned.
And there's more work involved.
Right.
I get
and,
that.
It's much easier to drive through McDonald's
than
it is to stop at Whole Foods and pick up something from there.
Whole Foods doesn't have the drive-through window where they just shove it out the window to me.
No. They encourage you to walk in there to the store.
Oh, that would also be movement. That would also be good for me. That makes sense. There's a lot of things we can do. You've talked about people who already have been perhaps diagnosed with having heart issues or having the knowledge that it runs in their family, so they certainly should be aware. Is there a situation that you come across where people who haven't previously had issues with their heart health enter that arena?
Well, I think what you're referring to is there are people what we would categorize as primary prevention. Patients that have not yet declared themselves per se and have known coronary disease, but we know that they're high risk. Their dad had it at a young age. They smoke, they have diabetes, they don't take care of themselves. So from that standpoint, primary prevention is very, very important. It's easier to prevent something than to take care of it after the fact. And also, there's a lot of people that their first heart attack is their last one, and that's kind of sad to think about. Primary prevention is no fun because, again, it's like smoking or wearing your seatbelt. You hope something doesn't happen, but preventing a heart attack, it doesn't necessarily make you feel better. It doesn't make you smarter. It doesn't make you run faster. But it's just like that seatbelt. If it does happen, you're very glad that you wore it. So primary prevention is a little bit understated.
I don't know about you, but I want to be around for a good long time. So if I need to take some preventative steps to help make me have a longer life and a longer quality of life, that doesn't seem like such a big deal. Do it, because it's worth it.
That's why you need to look in the mirror and say, am I worth it? And you are.
Of course you are. We're all worth it. I agree with that. Dr. Lee, I understand that Southwest Medical Associates has some pretty exciting stuff. I was just reading the other day about the Now Clinic, and they've got a lot of different alternatives to make it easier for someone to take good care of their own health.
Yes. I think Southwest Medical does a very good job at that because not only are we very preventive based, we're also very cutting edge as far as trying to get the technology out to our patients. We have e-visits where it's sort of like sending an email to your provider if you have a quick question, because it takes time to make an appointment. You either have to skip on work, do something like that. And so a quick e-visit, an email would be much faster and more effective. The other thing about Now Clinic, we have telemonitoring where our high-risk patients, we check their blood pressure every day, their heart rate, their weight, and if we see something, we're able to act on that before that becomes a problem.
Ongoing, it's keeping a closer eye on things
yes,
so that I don't just come to you when I have a severe situation.
Correct.
That's a great idea. Any kind of prevention that we can do is so much better because that, too, is where I see the expense. The expense comes in when I get really sick and I've really got an issue and it takes a lot to fix it if you can at that point.
Correct.
So once again, preventative is the way to go. I like the idea of these appointments that you can actually do through email. And there's an app I was seeing on the website where I can download an app. Everything else I do on my smartphone, so why not do that? Why shouldn't that go to medical appointments?
I believe they are working on that as far as scheduling wise. You could put like an e-request for an appointment of time as well. And most of your medical records are accessible for yourself. So say you had labs last week and your follow-up appointment with your physician isn't until a week or two later and you're really wanting to know what your cholesterol was. You're able to go online and check your cholesterol. And that way you may have a heads up as well as have some questions to have for your provider. So when you have your appointment, it's much more efficient.
That's a great idea. The appointment is only going to last so long. You guys can't give me all day long, so I need to come in prepared. I need to know, what do I want to know from you today? What kind of guidance am I looking for? Where do we stand? And if I've already had access to my labs and I see that my triglycerides are better than they were last time, then I feel better about that from the word go. But I also say, where do we go from here? What's our next step? It seems like when I go to see a doctor, if they make a suggestion, you need to lose a few pounds or you should get out and move more, I get the feeling when I actually follow those suggestions and come back in and go, hey, look, I lost the 5 pounds you were looking for me to lose. I have been moving more. It's almost like they're surprised. I wonder, Dr. Lee, if a lot of people just go, yeah, and kind of shine you on and go about their way and then come back in next time and it's the same deal.
Yes, it is a little frustrating. They have said that for smoking is very addictive. The nicotine, all that, the habit of smoking. Some research has shown that nicotine is 7 times more addictive than cocaine. So a lot of my patients that have heart disease were smokers or former smokers. So patients that continue to smoke, I tell them every time, you need to stop smoking. There's been studies that show that as we continue to tell our patients, eventually, one of these times, they will stop smoking. And so I do, as frustrating as it is and almost like a broken record, sometimes I do say, well, that is my job, to continue to, maybe be like your mom and say, you shouldn't do this. But mostly it's for your own good, because I also joke, if you continue smoking, you definitely keep me in business.
Yes, that's true. I'll need your help more.
If you eliminate some of those risk factors, smoking, lose weight, exercise, then I'm not as important per se. I don't need to see you as often because you have a very good game plan yourself. You could take care of yourself independently. And then periodically, just make sure your game plan is still doing well.
Dr. Lee, I would say that you actually are not less important, but you're more important because your good advice and perseverance in helping to guide me toward that goal has gotten me to a better place. That increases your importance in my book. One of the things that I've been really curious about with Southwest Medical Associates, or SMA, is these lifestyle centers, because I know there are 2 of them here in town. And they talk about the different classes. I'm really interested in finding out about things like Tai Chi, different things that you can learn about. There's dancing. It's really neat because they have so many different opportunities to get together with other people. And from what I understand, you don't even have to be an SMA client to use the SMA lifestyle centers.
That's correct.
So, Dr. Lee, if you had somebody with a mild heart condition of some sort and you were suggesting maybe they just need to get out and move a little bit, besides that smoking that they need to always quit, movement, a stop at the SMA Lifestyle Center might be great to encourage them to start that habit.
That would definitely be a great start because you'll meet other people that are very similar to yourself, and then you'll see, oh, this person could do it, I could do it, and then you kind of have this support group. But also I found that if you have a schedule, like if you attend the class, then you will be more, in a sense, regular on your health versus if you just did it independently, then you may just let it lapse. So going to an SMA Lifestyle Center would definitely be good just to kind of get plugged into the system, but also kind of have more schedule to your health regimen.
That's not a bad idea because it's much easier for me when it's just me in the house with my treadmill to go, oh, I'll get to that later. But if you actually have even a relaxed appointment time where you're going to meet up with some other people that you've gotten to know at an SMA Lifestyle Center and you go, we do this on Friday at 10 o'clock every week.
Yes.
I'm looking forward to it. We get together, it makes it easier. We do it as a group.
It's almost as though it's like an extra doctor's visit. You make the time to go see your doctor, or, when you bring your car in, you have an appointment to bring your car to get fixed. You have a tea time to go to golf. You become become more regular. But if you do it by yourself, then, not all of us have the same amount of willpower.
A lot of health companies these days are putting an emphasis on wellness, which I'm a big believer. Because really, if you can prevent it, it's going to be so much better in the long run. Things that used to be, you'd have to get a pre-approved or an authorization for something as simple as a mammogram or preventative health, now is part of the deal. Do it because it's so beneficial for you down the road.
A lot of these places, at health fairs, things like that, we do, in a sense, provide blood pressure check, weight, obviously. They also have some portable cholesterol checks. So people that may not have access to health care, we could screen them very quickly and say, oh, well, your blood pressure is a little high. We should get you plugged into the system. The other thing that you mentioned that is being more expanded, vaccines. Vaccines are very, very cost effective. The shingles vaccine, for instance, initially when it came out, it wasn't well covered, but now it is considered to be a preventive issue.
The shingles vaccine, if you've had chicken pox, which most of us have,
yes,
then the virus for shingles, as they say in the commercials, is already inside you.
Yes.
In adults throughout our lifetime, about 1 in 3 adults ends up with shingles, which apparently is quite painful.
Yes. The vaccine reduces significantly the chance of developing shingles in your lifetime, which if you've ever spoken to anyone that's had shingles,
it's not good news.
Yes, it's very painful.
There is a lot of preventative medicine out there that doesn't have a cost related to it. It's definitely worth checking into. How long have you been in the Las Vegas area?
So I've been here about 2.5 years.
Where'd you come from?
So before I came here, I was in the sunny state of Boston.
You're missing out on that winter they got going.
Some of my colleagues or friends eventually tell them, you can still have my shovel.
I'm sorry, I'm laughing. I know I got rid of my ice scraper. You don't have that anymore. You don't have to heat up your car anymore.
No, I don't.
Oh, darn.
I don't have to worry about black ice and slipping and all that. And this past weekend, I was out on the driving range and I texted my friend. I said, it's very nice and sunny here. If you ever defrost, you could come by and visit.
I'm thinking you're liking it so far. I'm sure that you were dealing with patients when you were back east, and now here. Is there any difference? Or is it pretty much all the same thing?
Cardiovascular disease is very similar throughout the country. I think depending on where you're at, there is a different level of coverage as far as for medical insurance, as well as different styles on treatment. Some places may be more, if you want to call it, aggressive with cardiovascular disease, where you may have more bypasses, more stents, things like that, whereas other places may be more conservative and really stress medication management, primary prevention, exercise, risk factor control.
As a cardiologist, we're talking with Dr. Jonathan Lee from the Southwest Medical Associates. By our lifestyle, you mentioned bypass, you mentioned things like stents. Can we, in many cases, prevent that stage of treatment by our lifestyle choices leading up to it?
I believe so. But it does take a level of effort on everybody's part. So you should see your doctor regularly, even when you're at a young age. It is recommended that, starting around, I believe, around the age of 20, you should have like a screening cholesterol panel. Everything looks good, you do it 5 years later. Annual exams will help track your weight, your blood pressure. If those things start to creep up, then you'll have some early notification. But again, kind of establishing those good habits ahead of time and preventing things from escalating in the future is much easier than after the fact.
You'll be happier, you'll be healthier, is good advice. As a cardiologist, Dr. Lee, one of the things that you would conduct, I would think, with your patients, a stress test. Are those pretty common?
Stress testing is very common as a cardiologist because that's one of our main ways of diagnosing and assessing cardiovascular disease.
A friend of mine had it done. He was on a treadmill and needing to keep his heart rate at a certain level to conduct the stress test. But I know other people who aren't able to do that physically.
Correct.
So there's another way.
When I tell my patients it's a stress test, it's not the nice spa day test because we do need to, in a sense, tax your heart. So there's multiple ways of stressing it. Usually through exercise is one of the better and more common practices of stress. Here in America, we use the treadmill, but in Europe, a lot of times for stress testing, for exercise, they do it on a bicycle, a stationary bicycle. Nonetheless, in America, we traditionally use the treadmill as our main ways of stress testing. But again, as you may figure, a lot of our patients are not able to walk fast enough or walk long enough for a good stress test. And so we have to give them other agents for stress. Yell at them? No. There are certain medications that will, in a sense, simulate stress. They will speed your heart up, make the coronary arteries in your heart dilate, or depending on what there is, we also use other agents that may just rev up your heart that simulate running stress. All stress tests also have a second component where we have to quantify and qualify the amount of stress or the reaction to stress that your heart endures. So when you are on a treadmill stress test, again, running on the treadmill, we have you hooked up to a blood pressure machine, machine, an EKG, and we monitor the blood pressure response as well as the electrocardiographic response to stress, and that will determine the outcome or the results of your stress test. For other ways of assessing stress, we may do echocardiogram. We also may do what we call nuclear myocardial perfusion imaging, and that involves injecting a second agent after your stress agent that will apply nuclear tracer to your heart, and then we take some very, I say, fancy images of your heart, and we could speculate or determine if there are any abnormalities in the heart arteries.
So you need this kind of test to be able to look deeper inside a person to see if they really do have a risk or if they already have a problem that's existing that just hasn't come forth yet?
Sort of. Stress testing is more beneficial for people that actually have limiting functional symptoms. So if you come and you see me and you say, oh, I have exertional chest pain, meaning I go outside, I push the lawnmower, I feel like my chest or my heart, something like that, starts to limit me. I feel difficulty breathing. You stop, you rest, you feel better, you do it again, and you get these symptoms. That would be something that would be worrisome for maybe some heart disease. And so doing stress testing would be helpful. And again, exercise stress testing a lot of times mimics what we do, meaning you go to the grocery store, you push the shopping cart. It's a little harder than not pushing the shopping cart. And if you feel like you get symptoms, then that may indicate some sort of heart disease.
But I don't have to run on the treadmill to get a stress test because there are other options.
Correct. There are, in a sense, pharmacologic ways of stressing the heart by injections that may speed up the heart, or also what we call vasodilate the arteries in the heart. Maybe not as predictive because they don't give us a sense of your functional capacity. Meaning if you go on the treadmill, depending on how long you run on the treadmill, besides whatever other information I get, if you run on the treadmill for a very long time, meaning probably more than 6, 7, 8 minutes, I could tell you that from predictive models, the chance of having some sort of cardiovascular event in the next few years would be very low.
Because I'm already able to do this length of moving really fast on the treadmill, so I'm already good there.
Yes.
Well, that's good to know. I do know people who have a certain amount of anxiety.
Sure.
When it's even mentioned for a stress test, even as you said, using some kind of pharmacological agent to make your heart mimic the kind of exertion that you would have with a stress test or with physical activity of some sort. I think the anxiety that's inside people probably makes it a lot worse.
Yes.
You know, a lot of stuff medically is mental, if you can just get over that.
It's probably also the fear of not understanding what's going on. And obviously, the body's very complex. And even for myself, you know, I'm a heart specialist. I had to go to school and training for many, many years. And so when I have my patients and they come back and we review the stress test or the echocardiogram, there's so much information there that I don't expect you to understand it. I always tell them, you know how long it took me to understand that echocardiogram that I read? It took me decades. And so there are little nuances and little details there that may or may not be important, but there are other values or information that we get from certain tests that the cardiologist would be able to interpret for you so that it will be predictive of cardiovascular disease.
So you can take that massive amount of information and distill it down to a little nugget that you give to me and say, you know, you're all right. You just might want to watch this and this. And
yes, kind of seeing the forest.
As long as you can see the forest, I'm good with that. We were just talking about things that we as individuals could do to maybe stave off or head off or just prevent, in the best case scenario, any kind of stent or bypass by our lifestyle, by our movement. And once again, that leads back to the SMA Lifestyle Centers that are available not just for SMA clients, but for anyone here in town. There's a lot of stuff going on there, opportunities to exercise and classes, and also I hear that they've got, through the SMA Lifestyle Centers, where you might get some additional medical guidance or information in the way of a presentation or a seminar.
Right. There's usually periodic, if you want to call it, lectures where a specialist or a primary care provider will be present to, you know, do a quick presentation on diabetes or high blood pressure or weight management. And that way you'll have kind of a more relaxed atmosphere as far as asking questions. You know, there's never a stupid question. The stupid question would be if you actually don't ask the question. You have a doctor there and you have multiple people with the same issues and you just want to know what the best way to treat it is.
That sounds like a great way to get the information, because I think that you're going to feel that extra stress and pressure when you're sitting in the doctor's office wearing that little gown and you're on the table and you're waiting to get your turn and they're coming around and you feel that you only have limited time. In the SMA Lifestyle Center, on the other hand, it's not that kind of surroundings. It's, as you mentioned, much more relaxed. And plus that other people who are also there for the same informational seminar, they all share the same concern and curiosity about what to do about that condition.
Right. Almost as though it's a brainstorming session. People just like yourself that have the same issues, and you may not think of that question. Oh, is it okay if I, eat this or do that? You may not have thought of those, but those are very important issues. And so having a larger group would also maybe come up with more educational points that you would never think of.
The SMA Lifestyle Centers, the website is going to be a great source of information. And as we mentioned, even if you are not currently a member of Southwest Medical Associates, as far as your doctors and your primaries and such, you can still go to the Lifestyle Centers, which means you can access all of the educational classes and the opportunities. And there are 2 of them here in town. There's one over on Southeastern. There's one on West Charleston. That information and more can be found at the website, smalv.com. As a cardiologist, what would be your number one suggestion to a person who's listening?
I would say stay positive. We're not always dealt the best cards, but we do have some sort of control. And if you have a good game plan with your cardiologist or your primary care provider, you can do it. You just have to put in a little bit of work, understand the guidance and the medications. But if you do all those, you will do better. Stay positive.
Cardiologist Dr. Jonathan Lee from the Southwest Medical Associates. Thanks for the good advice.